Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. I'm Dr. Mudassir Shahbaz, Associate Professor, Sahara Medical College, Narowal. Now today we are going to discuss about the blood supply of the heart. Blood supply of the heart. So first here, showing the blood supply of the heart. One is right coronary artery, other is the left coronary artery. And now, arterial supply of the cardiac muscles. They are supplied by right and left coronary arteries. They are called coronary artery because when they give branches, it looked like a crown on the head. In the ancient eras, the crown was made like that, hanging down from the head, and this looked like that. That's why they are called as right coronary arteries. And the both coronary arteries, they arise from the sinuses behind the cusp of the aortic valve. Now here is we are seeing the cusp of the valve. Coronary arteries, vasa vasorum, arising from the aortic sinuses here. Right one from right sinus and left one from left sinus. The posterior aortic sinus is non-coronary, and these sinuses, they are filled during the diastole, not in the systole, but during the diastole. So filling of the coronary arteries is in the diastole, not in the systole of the heart. Now here are shown the cusp of the aortic valve, right, this is posterior, this is left, and here are there is slight distension of the aortic valve, producing aortic sinus of vessel va, a sinus of from that sinus arising the right coronary artery, and from the left side left coronary artery. In the aortic sinuses, the sinus itself is guarded anterior by the cusp, and posteriorly is the slight dilatation of the aortic wall. Aortic wall. This is aortic valve. Opposite to that will be aortic sinus. Here again we see a view from above. A coronal section, you can say. Here is the left coronary aortic sinus giving origin to the left coronary artery. On the right side is the right coronary aortic sinus giving rise to the right coronary artery, and posteriorly is the non-coronary aortic sinus. And this is the part of central ring, that is the fibroskeleton of the heart. We have discussed earlier about the fibroskeleton heart. This is aortic ring of this fibroskeleton heart, to which the valve, they are attached, also the musculature that is attached to this ring. So here is briefly showing the left and right coronary arteries. After the right coronary artery arising from the right aortic sinus, running between the right atrium and the right ventricle, atrioventricular groove, then here on the inferior margin, turning to the inferior surface and running between the atrioventricular groove, reaching up to the interventricular groove, and here it gives branch, here this branch, the posterior interventricular branch. Left side we see left coronary artery running between the left atrium and the pulmonary trunk, emerging from here, dividing immediately into left anterior descending and left circumflex, which is winding around the heart and running between the left atrioventricular groove, reaching up to the this posterior interventricular groove. Here are shown the branches of the. Now we will see right coronary artery. This artery runs forward towards, pass to the right and forward, between the infundibulum of the right vein and right auricle. Infundibulum right vein and right auricle. Infundibulum, here is the infundibulum of the pulmonary trunk between the infundibulum and right auricle. Then descend down the atrioventricular groove. At here in this margin, it turns down onto the diaphragmatic surface around the atrioventricular groove, ending with the circumflex branch of left coronary artery in 60% of the cases. Here the anastomosis between the left circumflex artery shown faded posteriorly. So here we see right coronary artery rising, coming to the right between the infundibulum and the right auricle, running down between the right atrioventricular groove, reaching up to the margin, and then is turning between the posterior on the inferior surface of the heart between the right atrium and the right atrioventricular groove, reaching up to the posterior interventricular groove where it is giving posterior interventricular branch, and then it is having anastomosis with the left circumflex artery. So if we go back, here we see the branches, right mitral branch, right ventricular branches of the right coronary artery. Here is a branch is given to the SA node, SA nodal branch to the SA node. So this course is emerging from the surface of the heart between the pulmonary trunk and right auricle, then wind around the inferior border to the diaphragmatic surface and posterior interventricular groove. Termination by anastomosis with the left coronary artery. So here are the branches: 60% SA node, anterior atrial branches, anterior ventricular branches, then the marginal artery, then the posterior ventricular branches, posterior interventricular crux 70% of the right coronary artery, post atrial branches, avinodal branch. So here are the branches of the right ventricular artery. Area then will be the right atrium, ventricular, right ventricle mainly supplied by the right coronary artery. Small part of the left ventricle also, and posterior interventricular groove, and posterior part of the interventricular groove, interventricular septum also. Whole of the conducting system except the left branch of the AV bundle, the SA node is supplied in the case of 40% cases. So now we come to the left coronary artery. Here we see the left coronary artery arising from the left aortic sinus. Here we see it is running towards the left side between the behind the infundibulum of the right ventricle, and length is 0 to 10 millimeter only, and then bifurcates into the left anterior descending and circumflex artery. So it runs forward and to the left and emerges between pulmonary trunk and left auricle. Here anterior interventricular branch is given. Further continuation is by the left coronary artery's circumflex artery. By giving of anterior interventricular branches run into the left anterior coronary sinus and coronary sulcus, that is the sulcus between the left atrium and the left ventricle. Then it winds around the left border and near the posterior interventricular groove, it terminates by anastomosing with the right coronary artery. You see that here it's only 10 millimeter length from the left coronary sinus, from where it is getting origin, running between the pulmonary trunk infundibulum and the left auricle. Here it divides into or gives the branch left anterior descending, running in the groove between the two ventriculars, anterior interventricular groove, and then it's continuing as circumflex artery winding around the heart between the left atrioventricular groove, reaching up to the posterior interventricular groove. So continues left anterior, it's a continuation of the left coronary artery beyond the apex ends by anastomosis with the posterior interventricular artery. Here you can see it reaches up to the apex. So it gives off the AV anterior ventricular branches, diagonal branches. Here you can see diagonal branches running originating diagonally from the left anterior descending. Left conus artery in 40% of the cases, and here are the septal branches which are supplying the interventricular septum. Then is the circumflex in the atrioventricular groove, posterior atrioventricular groove of the left side. It terminate with the right coronary artery near the crux. So it gives branches atrial, then ventricular branches, then synodal in 40%, then the marginal branches, posterior interventricular branch in the 10% of the case, and also the Coggle's artery AV nodal branch. So here we see these are the diagonal branches of the left anterior descending. Here you can see the septal branches, and here are the ventricular branches of the left anterior descending artery, circumflex. Then here are the, in this view you can see, here are the marginal branches of the, here you see left, here are the marginal branches of the circumflex artery running at right angle to the artery. Then here is the posterior left ventricular branch, a big branch. Then it terminates by anastomosing with the at the crest of the heart with the right coronary artery. This posterior interventricular branch in 10% of the cases come from the left circumflex, and 90% of the cases come from the right coronary artery. This posterior interventricular artery that determines the dominancy of the heart, that we will see later on. Okay, now areas left atrium, ventricular, greater part of the left ventricle, and except the posterior interventricular groove, because it is supplied by the right coronary artery. Small part of the right ventricle and adjoining anterior interventricular groove. Interior part of the interventricular septum, part of the left branch of the AV bundle. So here we have seen the branches of the coronary arteries. Shown here, branches of the coronary arteries. From the right coronary artery, the anterior ventricular branches, this nodal branch, then is the marginal artery, then is the posterior interventricular artery, and here is the anterior interventricular artery, and the posterior interventricular artery. From the left side here, the diagonal branches from the left anterior descending, then is the circumflex, here is the obtuse marginal branches of the circumflex. So here is shown the anastomosis into the arteries which are of isolated interventricular septum from the left side have been shown. Here you can see it's the anterior interventricular artery which is giving branches to the septum, and except the posterior one where the posterior interventricular artery branch of the right coronary artery is supplying the interventricular septum. So one third here the AV nodal and branches which is supplied mostly by the right coronary artery, and only in 10% of cases it is supplied by the left coronary artery. Similarly, the SA node which is supplied by the right coronary artery. Here are the blood supply of the septum. Coronary collateral circulation means anastomosis between the right and left coronary arteries in the coronary sulcus between the interventricular branches around the apex. So this is called as collateral circulation of the heart, anastomosis, 10%. This table is given in the KLM and showing the right coronary as a nodal, then right marginal, the branches is the origin, course, distribution, and anastomosis has been shown here. So this can be seen in the KLM by the students. Coronary collateral circulation develops as a result of the arteriogenesis promoted by the chronic coronary artery occlusion that causes a pressure gradient between the proximal and distal bed of the in a serial direction. So it's a potential anastomosis that the arteriogenesis occur when required when there is chronic coronary occlusion in the right side or the left side. That causes opening of these anastomosis by the arteriogenesis. So then this coronary collateral circulation develops that the left side will be supplied by then the right side, and right side can be supplied by the left side by opening of this collateral circulation. Stress, shear stress pre-existing collaterals less than 200 micrometer, and growth factors no mediated. Capillaries in the ischemic region, they proliferate and they have little impact on the perfusion. Tremendous individual variability in the development of function of the collaterals. A sudden thrombosis developing in a chronic critical stenosis may still be minimally destructive. That is the recruitable collaterals. This is the benefit of the collaterals, that if suddenly the coronary artery develops in a chronic critical stenosis, chronic one, then the damage will be minimum because of these collaterals. In normal heart, there is no communication between the large coronary arteries, but many anastomosis do exist among the smaller arteries, 20 to 250 micrometer in diameter. This collateral circulation may delay the appearance of ischemic heart symptoms. Good. Then is the arterial supply of the conductive system. We have already discussed the as a nodal. It is supplied 60% cases by the right coronary artery. Atrium also supplied mostly by the right coronary artery. Right bundle branch is supplied of the atrium is supplied by the left coronary artery, and left branch supplied by the left and right coronary artery both, because the left one is larger one. Then we have seen here the sinus node is supplied by the right, and then the same one has been shown here. Coronary dominance. Coronary arteries that give posterior interventricular branch is supposed to be dominant, misleading term as left coronary artery supplies greater part of the myocardium, but in 70% cases, posterior interventricular is a branch of right coronary artery. Three types, right? 70%, left 20%, balanced 10%. So clinical importance is that in the left dominance, a block in the left coronary artery affects entire left ventricle and IV septum, while in right or balanced dominance, a block in the right coronary artery at least spares part of 2/3 of septum and its ventricle. Okay, now is the venous drainage of the heart. Here we are seeing venous drainage of heart. The veins runs along the arteries, and then they are drained into the right atrium, and veins also which are draining directly into the right atrium. Here you see the marginal branch along with that running the vein, and it is entering into the directly into the right atrium by the small cardiac vein. But mainly here you see the vein running along the anterior interventricular artery is the great cardiac vein, which is going upward, receiving tributaries. Then it turns around, runs in the posterior atrioventricular groove of the left side, and receiving the oblique vein of the left atrium and posterior vein of the left ventricle, and then is going down, 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 and receiving also middle cardiac vein, and then entering into the right atrium through coronary sinus. So this part here is a great cardiac vein, which is then named after the entry of the oblique cardiac vein, named as coronary sinus. So here we see great cardiac vein running along the anterior interventricular groove, going upward, then is turning around, and then here by the oblique cardiac vein it becomes the coronary sinus. The great cardiac vein is receiving left marginal vein, and on the right side you can see that here the small cardiac veins from the middle cardiac vein, they are also entering into the coronary sinus. Here is the left posterior interventricular vein, which is also entering into the coronary sinus. So coronary sinus is drained by the heart is mainly drained by the coronary sinus that empties into the right atrium. Two sets of vein into the right atrium directly. The veni cordis minimi, small veins, anterior caudal vein, and right marginal vein. They enter. We have seen already in the diagram that these veins are running directly into the into the right atrium. The coronary sinus dilatation of the great cardiac vein located in the posterior part of the atrioventricular groove. So it's actually the continuation of the great cardiac vein, coronary sinus, that opens into the right atrium between the inferior vena cava and tricuspid opening, guarded by incomplete semicircular Thebesian valve. The tributaries are all except the vein of the left atrium. So tributaries, here we see great cardiac vein. Great cardiac vein is the vein in the anterior interventricular groove. So begins near the apex, runs upward, anterior interventricular along the anterior interventricular artery, or more proximally the crux artery, terminates ending in the coronary sulcus. Middle cardiac vein, here we see middle cardiac vein accompanying the posterior interventricular artery and opens the termination of coronary sinus. Small cardiac veins accompany right marginal, then the runs in the AV groove to ends in the right end of the coronary sinus. Here are the middle cardiac vein, is the left, and there are small cardiac vein here, which are entering into it. Small cardiac vein, oblique vein of the left atrium, here of a vein of Marshall here. It is said that the great cardiac vein receiving all the tributaries, when the vein of Marshall, oblique vein of the left atrium, enters into the coronary sinus, joins the great cardiac vein, then it is named as coronary sulcus. Posterior vein of the left ventricle, and then is the right marginal vein. So here we see oblique vein of the left atrium, vein of Marshall. It is said that after this it is named as coronary sulcus, which is running between the groove of left atrium and left ventricle, or you say atrioventricular groove, at the base of where the inferior margin of the base of the heart, inferior in the groove at the inferior margin of the base of the heart. So vein directly emptying into the right atrium, anterior cardiac vein, veni cauda minimi, Thebesian veins, small cardiac vein. They are opening directly into the right atrium. So here is the venous drainage of the heart. These are some X-rays of the heart. And this is about the blood supply of the heart. Inshallah, we will discuss. Blood supply of the heart is very important to understand, because the number one disease in most part of the world, it is the ischemic disease of the heart. So it is very important to understand and look at the blood supply of the heart. and we will inshallah discuss the clinical later on. Allah Hafiz.